This is the biggest increase to the incentive ever.
Reviving that beating heart of Medicare, a game changer for tens of thousands of general practitioners.
Our Labor government will triple the bulk billing incentive.
It's the $3.5 billion budget centrepiece. From November 1st, the financial incentive paid to GPs who choose to bulk bill will triple. The more remote the practice, the higher the payment. It's for GP consultations with kids under 16, concession card holders and pensioners, meaning 11.6 million Aussies qualify for free visits to the doctor.
Right now, too many are finding it more and more difficult to see a doctor. Families are being forced into a lose-lose choice between getting the help they need or paying their other bills.
The government hoping clinics pass on any savings from the cash injection to other patients too.
I know doctors want to do the best thing by their patients.
And stem the tide of GPs abandoning bulk billing. Currently, just 35% of clinics across the nation see patients for free.
We expect that this will at least slow the decline in bulk billing rates. We do expect that, particularly in highly vulnerable areas, that this measure will go a long way.
But the devil is in the detail. The new measures don't guarantee free healthcare. It's just an incentive.
I'll say this to my GPs in Tasmania, quite frankly, there's no excuse anymore and I will be coming for you.
And it's unclear how many doctors will actually take this up.
The expectation is that parents are going to be able to take their kid to a GP and be bulk billed. Is that going to happen 100% of the time? 80% of the time? Half the time?
More doctors will bulk bill as a consequence of us paying them 3 times what they were getting before to do it.
But some GPs are already flagging they won't.
This really shows the immense pressure that's on general practice at the moment and the huge disparity between the cost of providing a high-quality consultation and the Medicare rebate that goes back into a patient's pocket for that time and expertise.
So is this
a game changer
or not?
Dr Mukesh Harkawal is a GP in Melbourne and he joins us now. Doctor, this seems like a pretty big boost. Is it a game changer?
Good evening. Well, it is what we haven't seen for a while, which is a good injection of cash into the Medicare system, which has been starved for at least 15 years, with no indexation of Medicare rebates for you and I as citizens. So the rebates that you and I get for when we go and see a practitioner it has not gone up by more than 0.5% over the last 10 years per year. So at least there's a recognition. And what's happened here is an incentive, not the rebate. The incentive has increased by threefold, from $6.60 to just over $20. So that means that people who are currently able to bulk bill their patients have left the door open a bit longer to continue bulk billing their patients, which will be those under 16, those with a healthcare card and those who've got aged care pensions. The problem, of course, is that the others who are not eligible for that incentive don't have any change to their rebates until November. And what we will see is the reasons that we have seen changes from reduced in bulk billing rates and practices closing and people leaving the profession and actually not entering the profession are still remaining to be addressed. Now, obviously, you can't expect that to be done in one budget, but this is a move in the right direction. Certainly, we see people who have benefited from bulk billing for 15 years despite a lack of increase in rebates, continuing to do that as the door is prized open a little bit longer by a threefold increase in the incentive, not the rebate.
Doctor, will you continue to bulk bill at your clinic?
Yes, so we have people that we do bulk bill in our practice, and they are the aged care pensioners and those on the healthcare card and their families. And we have our hours open for that. And as I said, the door is prized open and remaining open for that with this supportive initiative.
I know that not everyone qualifies for this, Doctor, but surely a safety net for our most vulnerable communities has to be a good thing.
Oh, it's a good thing that we have some support for people in that. But you see, certainly in urban areas where rental is higher, we have problems where people are having to endure the same cost of living expenses as absolutely everybody else as a small business. And they've had to raise their fees, and therefore people are paying gap fees. So those fees have gone up around $45 to $55 a consult. And so if the rebate is not changing and the incentive is $20, then the $20 doesn't make the $45 to $50 that others are having to charge. So there is an incentive. It will be useful for some groups, and that's very welcome. There is a whole lot of work that needs to be done to improve the system, improve the connectivity of our system, and make sure that we work across the system with the state hospital system, and make sure we have ongoing services for our patients.
All right, Dr. Mukesh, thank you so much for your time tonight. Appreciate it.
Thank you. Good evening.